Now, coming to the history to the use of tourniquet surgery. Now, as you know, the origins are linked to amputation surgery, where basically you tie one tight cloth above the level of amputation and one tight cloth below the level of amputation, chop the limb in between, and you have a bloodless field where then you can hold the artery nerves and ligate them off. But this is back in the dark ages where the newer techniques of amputation were not described then. Okay, and then it was not until 1864 that Lister described the use of tourniquet for a procedure other than amputation. Okay, and Lister also pioneered the principle of uh, exsanguination of the limb prior to application of the tourniquet. Okay. Similarly, later down, about 10 years down the line, S. March, he described the use of a flat rubber bandage to exsanguinate the entire limb. However, he told to use it with caution in patients who are having an infection, such as a flexor tenosynovitis, etc. Okay. Then, by the turn of the 20th century, Harvey Cushing, he described what a pneumatic tourniquet was. Now, what are the advantages of a pneumatic tourniquet? It was quick to inflate. You could monitor it with the help of a manometer. It reduced the incidence of nerve palsies, and it could be continuously monitored. Okay, and of late, with all the world wars as well as the higher military presence, the use of emergency tourniquets have also come into being. Now, emergency tourniquet definitely is being used in military warfare, but even in regular polytrauma patients where the limbs are exsanguinated, and most of our general population as well as the geriatric population who are already on some amount of anticoagulation. It could be aspirin, it could be clopidogrel, or any of the newer methods of anticoagulation. These patients who are already on these drugs, when they undergo or when they come into a polytraumatic situation, the small wounds tend to bleed out very fast. And it is in those situations that tourniquet use has also emerged as a lifesaver or a limb saver in many conditions. Okay, so this is the history of the use of tourniquet in orthopedic surgery.